Hello, how are you? Welcome to a new installment of your Pharmacy Assistant. On this occasion, we would talk about what it is used for and how it is used. So let's take a look.
Hey everyone, today I want to talk to you about Glyburide, a very important medicine for many people with diabetes. Glyburide is mainly used to treat type 2 diabetes. It's a good option when diet and exercise aren't enough to control blood sugar levels. For example, it can be prescribed to people who have just been diagnosed or to those who need a little extra help along with other medications. So how does Glyburide work? Well, this medicine belongs to a group called sulfonylureas. What it does is stimulate the pancreas to produce more insulin, and this helps lower blood glucose levels. Now, let's talk about how to take it. It is usually started with a low dose, which is gradually adjusted according to how each patient responds. It is very important to take it with a meal, usually with breakfast, to prevent blood sugar from dropping too low. Remember that you should always follow your doctor's instructions and not change the dose on your own. Like all medicines, Glyburide can have some side effects. The most common are dizziness, nausea, and some weight gain. In very rare cases, it can cause a severe drop in blood sugar. That is why it is important to check your blood sugar levels regularly and be aware of any strange symptoms. In short, Glyburide is a very useful tool for controlling type 2 diabetes. The most important thing is to follow your doctor's recommendations and take good care of your health. Thanks for watching this video. If you have any questions, feel free to leave them in the comments. See you next time.
If you've made it this far, let us know in the comments why you're using this medicine.